Today's discussion is going to be on the pre-cleaning and transporting of your fiber optic scopes. These are your fiber optic intubating scopes. They have a very thin, small insertion tube. They have a suction port here, and this is your additional suction port. We like to call that a Christmas tree. Okay. This is a portable fiber optic scope, and you have your light source here. Just so you're aware, your light source attaches to your unit and will screw into place. Alright. You also have your suction button adapter that you will need to retrieve. It's right into the port here. Your light source as well as your suction button can be found in your drying cabinet currently. Okay, and they're at the bottom of the drying cabinet. You currently have about 5 different fiber optic scopes. You have one that has a suction port capability, and you have another one that does not have a suction port, nor will you find the suction hole on top. Okay. All right. I want to talk a little bit about when you retrieve your scopes. They are hanging in a drying cabinet, and when you retrieve any scope, you must make sure that you have on gloves. We do not want to cross-contaminate our transient microorganisms from our hands onto the scope that will thus be used on the patient. So when you go into your clean utility room to retrieve your scope, please make sure you have on gloves. You're going to pull your scope down. You're going to grab your attachments. If it's a portable, please make sure you grab your portable light source and your adapter button. Okay. You also want to make sure that you have your impervious puncture-proof bin that is lined. Okay. And then you want to proceed to put on your green lid liner for transporting to your designated room. Okay. You will go ahead and hook it up to the monitor, and then the doctor will use it on the patient. Okay. Supplies that will be needed for your pre-cleaning process will be your first step pre-cleaning kit. It's 200 milliliters of an enzymatic solution with amylase, protease, and surfactants. It will address your proteins, fats, and carbohydrates, as well as blood. You will also need a little bit of rinse water that you will follow behind the enzymatic solution. Okay. If your scope is a scope that has your suction capability, then you will have a suction tubing as well as a canister that will allow you to suction through your enzymatic solution. However, if you do not have a scope and you pull a scope that does not have a suction port, your little Christmas tree, you will need to retrieve a 30 cc syringe. Okay, so we're going to have to flush through your biopsy channel. So we will start with the scenario that the doctor's in the room, he's used the scope on the patient. He's finished with the scope, and you are on. We ask that you have on all of your full PPEs, that is your gown, your gloves, and again, your face shield. Okay. You'll go ahead and detach the scope from its unit or the monitor, or go ahead and detach your light source. We ask that you orient your scope into the bin, as the bin is your working space. Okay? That would not be your counter or a sink. It's going to be your bin. In this case, we'll take your first step pre-cleaning kit, which is free and self-standing. Go ahead and peel it open. In addition to that 200 milliliters of an enzymatic solution, we have a crinkle pad. So you just want to go ahead and squeeze out some of the solution. You want to take this and go over the length of your scope. And make sure that you're very careful with your scope. We do have fiber optics and a camera in the distal tip. Any banging or dropping of this could damage the scope. Okay? And wipe that down. Gently set it down. And for this particular scope, we do have suction capabilities, but we do not have suction here. So we're going to demonstrate as if this is a scope without suction capabilities. We're going to need to push through 90 cc's of this enzymatic solution through the scope's lumen, followed by 120 of regular tap water.
Why do you choose a 30 cc syringe?
The reason why we choose a 30 cc syringe as compared to perhaps a 60 cc syringe is our insertion tube and the lumen of the diameter of the lumen here is very small. We don't want to push it too fast. We might blow out or create a hole. If there's a weak area in this scope, we might potentially blow out the weak area. We could damage the scope by pushing through fluids too fast. I'm going to go ahead, introduce our syringe into our port. We're going to stick the distal tip into our first step pre-cleaning kit. And we're just going to push it through, oh so slowly. It's going to return into the pouch. That's okay. At this point, we're just trying to flush the internal lumen. We're not concerned about the bioburden that's going back into there. It will be high-level disinfected once we take it upstairs. Push that through. And when we push it through, it is slowly. Now and again, if we had suction capabilities, we would have a suction connector tubing. We would again just stick the distal tip in, and we would depress our suction button, and it would suck up the 200 milliliters of enzymatic solution. But if you were having to do it in the manual fashion, you want to use a 30 cc syringe, so we do not blow out any weak areas, and push through our 90 milliliters of enzymatic solution. On the scope that has the suction capabilities, we will just transfer it over to our container with water. A graduated cylinder is fine, an Emerson basin, and you're going to depress your suction button, and you're going to suction up copious amounts of water. After that, you will return it to your bin, remove your PPEs, and put your lid liner on. If this were a scope that did not have our suction capabilities, we would take our tap water in our container. I always advise that you suction up as compared to trying to stick the distal tip into the pouch or in the water and suction through. We do not have a lure lock on this particular model of scope. Okay? Holding it as such. We orient it into our port, which would be our biopsy port, and we would push it through slowly. Okay? That's 90 of the enzymatic solution if you have to do it manually with a syringe, and 120 with your regular tap water. If you, again, have the suction capability port, which is your Christmas tree, it would be the entire pouch, followed by copious amounts of water. That would be 120 milliliters or more. Okay. We're going to, again, orient our scope back into the bin. Remove and or change your gloves. You would dispose of your water and your pouch. Put on your red lid liner and attach your patient information. Patient information is required on all fiber optic scopes. At this time, according to our regulatory compliance mandates, this scope must be transported up to the sterile processing department where it is reprocessed, and it must be reprocessed within an hour after the point of use. So we're going to transport to our sterile utility room, but if you have the opportunity at that moment, we ask that you go ahead and take it up to sterile processing.